with Sarasota Point Rehabilitation Center, which is a skilled nursing facility. So I'll talk to you a little bit about the rehab aspect of Sarasota Point and about the long-term care aspect. So they're kind of function separately. So who has been into a rehab center because they've had their knee replaced or they had a short stay in the hospital? Not very many, or we're just being shy. Okay, maybe we're being shy. And then the other aspect is skilled nursing, long-term care, what we like to call the nursing home portion, okay? So I'll talk about rehab first. And the services are all the same, whether you're in for short-term rehab or you're there for long-term care, you are offered all the same services. So, and it's a lot similar to what Ann has to offer at assisted living, but it's just one step further. So the folks who are living at assisted living, they're functioning more independently than what the people are who are in skilled nursing for long-term care. So there are 3 meals a day provided with snacks in between. There are at least 3 activities that are happening a day. There are a wide variety of nurses available. So there are typically a few RNs in the building during regular business hours, and then also when things kind of quiet down, there's 1 RN in the building, and there's a doctor on staff. And all those skilled nursing and rehab facilities function differently with what their staffing is, how many doctors they have. Some facilities have specialty doctors. All the facilities have at least 1 primary care physician that oversees the care of the patients. But there are some patients who have their own physician who wants to follow their care through the rehab facility, whether it's for short-term rehab or for long-term care, and that can be arranged as well, especially for people who either pay a concierge doctor to watch out for them, or they've had the same physician for years and years, and they want to keep that continuity of care. That is allowed in most skilled nursing facilities. So if someone's coming in for short-term rehab, then they can come in ahead of time if they know that they're having an elective surgery. A hip replacement, a knee replacement, sometimes even with cardiac surgeries, those are planned ahead of time. It's a good idea to go out, take a look at the rehab facilities, and see where you fit best. Just like Ian said with assisted living, you want to go tour a couple places and get an idea of what that next step is going to be after the hospital stay. So most of the patients in skilled nursing are covered under a Medicare benefit, and Medicare requires you to stay in the hospital for 3 nights as an inpatient. Now that's important that you're categorized as an inpatient. Sometimes patients stay under observation and they can be in the hospital for many, many, many days under observation. We actually just took a patient into our facility that had been under observation for 10 days. So it can happen, and a lot of times the patients don't know they're under observation and the family members don't know they're under observation, so make sure you're checking that status with the case manager at the hospital. That's the person who helps with the discharge plan. But once you're there for 3 nights minimum, you can transition into a skilled nursing facility after the doctor writes an order, and our order is called a 3008. And the physician fills it out on the day of discharge. It has a list of medications as well as how well you can see and hear and what your cognition is and your diet and all the things that are necessary to initially get started in taking care of you. With medications, we administer the medications to the patients. So once the patient arrives, we verify that the medication list is accurate. And then the nursing staff only, they're the only ones who have permission by the state to order or to issue medications to patients. Okay, so it's a little different than in assisted living. And then rehab services are offered, depending on the facility, they're offered 5 to 7 days a week. There's physical therapy, occupational therapy, and speech therapy, depending on what your need is. And then if you're there for short-term rehab, you stay until you reach your prior level of function, or you get as close to that as you possibly can, and then the discharge plan happens. So most of the times patients will go home with home health care and then continue on with outpatient therapy. Sometimes patients aren't able to go back to their prior living environment, depending on what their medical condition looks like. So there's the option to stay in skilled nursing for nursing home care, or there's an option to go to assisted living and start the future there. So if someone is either transitioning from the hospital for long-term care, or coming from another nursing facility, or coming from home, all those, it can happen anyway. With our facility being a newer facility, we just reopened in August, I'm getting a lot of calls from people wanting to transition their family members from home, as well as people who are at other skilled nursing facilities and maybe aren't 100% pleased with the care they're receiving there, so they're looking to a new environment. And sometimes it has to do with care, and sometimes it just has to do with wanting a change. I was over at another skilled nursing facility talking to a lady a couple weeks ago, and I asked her why she wanted to move, and she said, well, you know, you buy a new house and you move to a new place. Well, I've been here for a little while, a couple years, and I kind of just want to try out a new place. So that happens as well. And if someone's under long-term care, then Medicare doesn't pay for long-term care, and insurance doesn't pay for long-term care. Now, some people who have long-term care insurance, that pays a portion, and if you have long-term care insurance, I know a lot of you raised your hand for that, you'd have to check your policy and see what is covered. But it's either private pay, which depending on the type of room you need, semi-private rooms are less expensive and private rooms are more expensive, but they range about $7,000 a month to up to $11,000 a month for private pay. And some facilities are, all their beds are Medicaid certified, and some facilities, only a few of their beds are Medicaid certified. So the building I was in before, we only had 13 out of our 60 beds that were certified for Medicaid, and in the building I'm in now, we have 120 beds, and all are certified for Medicaid. So, and that's the program that the state pays for, and you have to qualify to receive Medicaid benefits from a financial standpoint, as well as from a clinical standpoint. Did you have a question for me?
Yeah, a quick question.
Sure.
Now, when I was in physical therapy in the hospital after knee replacement, right, they offered physical therapy, occupational therapy, speech therapy,
yes,
nutritional therapy. Do you have all those in your program too? We do.
And Sarasota Memorial has the comprehensive rehab unit. Is that where you were?
No, I was in Tampa.
You were in Tampa, okay. So Sarasota Memorial has the comprehensive rehab unit in their hospital, and Health South is the other facility in town that they fall under the same category. They are a transition from the hospital. They're in-house therapy, and the therapy there is pretty, the criteria is pretty strict. You have to be able to do 3 hours of therapy a day. You're still within a hospital setting, and it's a great option for therapy. And because you get a lot of therapy when you're there, if you're able to do it, but then also those days don't count against your Medicare skilled nursing days. So you can transition from there into a rehab center if that's appropriate for you. You probably aren't 65, right? So you are? Wow. Okay, well, I was going to touch on just the insurance piece a little bit, and for people who aren't 65 and don't have Medicare, or if you have a Medicare Advantage plan, Sarah mentioned Medicare Advantage plans, and all those policies are written differently. So if you're looking at going into skilled nursing, whether it's, well, really for short-term rehab, then you'll want to make sure you do some research ahead of time. Go tour the facilities, choose ones that you like, and then have those facilities contact your insurance company, because more than likely you'll have an out-of-pocket expense to go into skilled nursing unless you have a you know, a Cadillac policy, most of them don't cover 100% for skilled nursing.
And they sometimes tell you they do,
and then they don't. You're right. He makes a good point that it's an estimate of what your cost is going to be. You don't know what the bottom line will be until you actually submit the bills to the insurance companies. Okay.